Veterans dying while waiting for care, widespread mismanagement of claims, benefits denied. That's just the tip of the iceberg.
Ever since last summer's Phoenix VA hospital exposed massive backlogs, the leadership at the VA has changed, while billions of dollars have been spent working to fix all the problems. In a KOIN 6 investigation, our Eileen Park has learned things have not improved. She joins us live from the VA in Southwest Portland. Eileen, what did you find out?
Yeah, Jeff and Jennifer, I found out that nationally, veterans are actually waiting longer for care than they did last year, despite all of that money. And here in Portland, we kept getting tip after tip from veterans who say they're waiting for months just to get the care they need.
The bottom line is, why is it taking so long?
Vietnam veteran Victor Lansaw can't get that question out of his mind.
I personally have been waiting going on 11 months just to get my treatment taken care of.
Lansaw says after spending a year in Vietnam with the Coast Guard, he suffers from PTSD and severe back pains.
I couldn't sleep. I couldn't stand. I couldn't walk. I couldn't sit. It was very painful.
Lansaw reached out to the VA, but claims he was getting the runaround.
Okay, well, go talk to this person. Okay, well, go talk to this person.
He's not alone. In fact, this is how the VA healthcare system operates. For every appointment, you first need to get approval. That can take weeks. Then you need to schedule the appointment. That could take another few weeks.
And it's kind of like I'm speaking, but nothing's coming out because nobody really listened.
So I took his concerns to the regional VA.
It's been more than 1 year since the VA scandal, but wait times are actually up nationally. Why?
Yes, they are up because of the increased numbers of veterans who've come to us for care.
Joanne Krumberger is in charge of all 12 facilities under the Portland healthcare systems.
I'm up 37,000 visits, over 4.5% increase. My operating room cases are up by 9%. I have a 4.6 total growth.
I spent days looking at all of the data we requested from the VA. I found month after month the number of veterans seeking care is actually going up. In the Portland VA Medical Center, for example, almost 7% of the veterans for the month of September were waiting longer than 30 days for care. That's higher than the national average, which is around 3%.
Is there still work to be done? Absolutely.
Although the majority of veterans in the Portland systems are seen within 30 days.
We still have some areas where we have long wait lists, and we know exactly where they are.
That still leaves thousands of veterans like Victor Lansaw in the Portland system waiting longer than 30 days for care. To reduce the backlog, President Obama signed into law the Veterans Access Choice and Accountability Act in August. It allows veterans like Lansaw to see doctors outside the system for their care. So with more doctors and physicians available, the wait times should have decreased, right?
It takes anywhere between a week,
Wrong.
2 weeks, or longer to get the next approval.
So a program that was designed to help veterans isn't in fact really helping them.
We would be the first to say that there were huge growing pains.
That's because the VA only had 90 days to implement the act.
If you were to develop a new program like Choice in the private sector, you would spend at least 14 months to 16 months planning that before you rolled it out.
The U.S. Department of Veterans Affairs was not prepared for the amount of paperwork and confusion the new law created.
There was no computer system developed at that time to be able to do it electronically. So we had to count on what I call manual labor, counting every veteran individually.
And stuck right in the mess of it all. Men and women of the armed forces finding a way to cope with the physical and emotional tolls of war.
I don't talk about this very much. Sorry. Seeing what these people went through, you hear the horror stories. Unless you've been there, you can't relate.
And one of the biggest reasons for these backlogs is the turnover problem. The Portland VA and the National VA has always had a problem with keeping their staff. So if you are in the healthcare sector, you have dozens and dozens of jobs to choose from. We put that information right now on KOIN.com. Jeff and Jennifer, back to you.
Eileen, a great investigation, very eye-opening. Thank you.